Good morning. Thank you for coming to Clever Dental. Come on in.
Okay. I want to show you actually something. Let's go. So I would like here to show a patient whom we have seen quite a time ago. And so what happened here is the patient came to our office with the history that he fell from biking on his bicycle and had a severe fall, and so he was admitted to emergency room, and they kind of checked him and released him. And about a week later, he said that increasingly he has difficulties in chewing and has pain, so something is going on. And so asked me to take a look. So my first question was whether he was x-rayed, whether he received some x-ray imaging in the emergency room, because obviously if somebody fell severe, and you can see still here about 10 days after the injury, still you can see scars. So it was a severe blow. And so he said no, because he didn't have any money, so they decided not to do any x-rays. So I then performed an x-ray on him, and we can see here what I see is that two things are visible. First of all, this is obviously his jaw, and you see here multiple teeth are missing. We will get later to this situation, but immediately what one sees is that here is a fracture, goes here along, and here is even a little dislocation. And then the second thing what is visible is this condyle here. If you compare the left on the right side, so you see how this is up straight, and this is kind of, it has a different angle. So obviously what happened here, he had at least on two sides a fracture in his mandibular, dislocated here in both sides and here as well. And so obviously I have referred back to the emergency room and asked what is going on. Anyway, so this, I see here, I have actually here a note. This was in Fitzsimmons. Pan not taken due to patients had no funds, according to him, to the phone calls I made then. This was, by the way, in May 2009, so today, 11 years ago almost. So thankfully, the Fitzsimmons still understood that there was a mistake, and they have gotten the patient back and did some treatment stabilization. So from there, he was taken care, which is good. And then I would like to point out what is the situation otherwise with this patient. So we see here, this is a picture which I have taken of the maxilla of the upper jaw. And you see here a couple of things. First of all, obviously you see how multiple teeth are very much decayed. But you see also that here is a developmental problem. So this patient was born this way. There's a cleft. And here the soft palate has a perforation, and this is obviously something what should have been operated, surgically fixed much earlier during the childhood. And so one can just wonder how it can be that in such a rich country we meet such patients. This patient is about 45 when I met him 11 years ago. He is going through his life this way in a country which is flying to moon on a regular basis. And so just going here through the pictures here, this is the lower jaw. You can see how the teeth are worked up and decay. And so this is something what we sometimes see, this extreme situation obviously. And no, yeah, so I just want to go here through now how we were able to help this. Obviously, there is a problem with financial situation as well, because this goes very often along. We call it nice smiles, open doors. Obviously, if people want to have nice jobs, they need to have a decent appearance, and teeth is a big part of it. And somebody who has this appearance very likely won't have very high positioned, high paid job, even if he has skills. This person is very educated actually and very skilled. So just pointing out here the situation, and since he has no insurance, no health insurance, we kind of strive to help him, and as time went on and he couldn't find anyone who would help him in a way how it's supposed to be, so I have taken this case, which is usually not the normal way of patients we see here, and we then did here a couple things. So I have removed a couple teeth which are not restorable and placed in this area on the one side, and on the other side I placed one implant, kind of placing it using most possibly the space, and then we got him a temporary bridge here. You see here, this is the status after decay was removed and teeth are somewhat already straightened, and this is the temporary in place. Here you see actually the implant. One of the implants is still in healing phase. Then in the lower we did some crowns to cover and to improve obviously the occlusal situation, so the way how the patient is biting. And so this is just here, I'm going just through a couple x-rays. Then here, this is the situation where we see here the temporary bridge and the two implants to close the gap. And then let me see, yeah, this is now the healing situation of the implants. So here this is after 6 months or so, so we have one implant which is healing and the other one as well. So now here we have the technical aspect of this work, and I want to show here for a second what we did. So we did a metal frame then, and here we can see this is the area, by the way, which is missing. So you see how big this bow is, which is missing. So I placed here one implant and one implant here. This looks like it is number 14, and this here looks like it is number 8. And then we have combined those two and those two to have the bridge nicely fixed, because 2 implants would not be sufficient. On the other hand, we have natural teeth here, and usually we don't like to connect natural teeth with implants, but here again I used, if you want, an approach which is not taught in the schools, at least here in US. But what I do in order to preserve the natural teeth from decaying if the cement breaks, because the dynamics of the implants and natural teeth is different. So before placing the final work in the frame, we protect the natural teeth with an extra cap, and this is being used with the strongest cement possible, whereas then the construction here is being placed on softer cement, and this way, if there's movement, then the cement may break or may lose a little bit, but the tooth with the primary crown still stays connected. And so here this is try on, I think we're already cementing, we'll see it in a second. Yeah, so this is how it looked then after we have placed here all the teeth, and this was in 2014 already done. And so I can just overgo this everything else, because patient actually fell again on the bike. So this was like 4 years ago. Here again, fall. And here's actually another solution which we did, because you see that the frame is still intact, but the porcelain broke. So I didn't want to remove obviously this whole frame, which is nicely fitting. So what I did here, I removed the porcelain, prepped it as if it is tooth, and then we placed here above this part which was missing. We milled this on our computer design and milling system, and just cemented this back. And here this is now the last x-rays we have. Let me see what we have here. Yeah, then lower teeth, couple of them failed. So, but in general, I want to point out here, this is status 1 year ago, so 10 years after placement. So you see here, we have this one implant still nicely with this tooth here in place, and obviously we need to see him on regular basis. Not usually is not very good in coming back, so we always have to add a couple things if it appears, but all is actually not too bad. We see here also how the condyle healed here is a little shorter and differently angled than on the right side, but otherwise, so this is one of the cases where we can say we really were able to make a deal, big help for the patient.